Welcome back to the Healthy Chicago podcast, where local health professionals and their guests discuss the latest public health issues affecting Chicagoans.
Hello, Chicago. It is summer, it is Friday, and we have a lot to celebrate today. It is Dr. Olusimbo Ige. I am the commissioner for the Chicago Department of Public Health, and I'm here with some great partners today and colleagues. And I will start with Craig. Craig, will you please introduce yourself and let our viewers know who you are?
Sure. My name is Craig Williams. I'm the Chief Administrative Officer for Development at Cook County Health. In that role, I do a variety of things, but one of the most exciting things I've done in the 2 years I've been here is provide oversight for our new arrivals healthcare program, and have the opportunity to work closely with Dr. Ige during that effort.
It's been fantastic, and we cannot wait to dig into it. Thank you, Craig, for your partnership. And I will pass it on to Dr. Vohra. Dr. Vohra, who are you and why are you here?
Well, Commissioner Ige, Samir Vohra, I'm the director of the Illinois Department of Public Health, the state's top doc, and have been so for almost 2 years, appointed by Governor Pritzker to this role on August 1st, 2022.
Oh, welcome and thank you for joining us. So these are our partners with CDPH, and we have just declared an end to an outbreak of measles in the state, in the county, and then in the city of Chicago. But this is a wonderful, great achievement that we want to highlight just for the public health community and for the residents of Illinois as a whole, to understand how our public health and healthcare system work together to protect the health of the residents. And this is an outbreak where we had 64 cases in Chicago alone and 67 total in the state. And it is one of the largest outbreaks we've had in many, many years. So it is significant that we were able to collaborate together to solve this issue. And I wanted to just elaborate a little and expatiate a little so people understand how this happened. Dr. Vohra, if you will start, typically when there is an outbreak, it starts in the city has jurisdiction, but we quickly realized that this is big and we're going to need help. So we reached out to the state, and I wanted to just, share with us some of the very many ways where that the state of Illinois, IDPH, and partners at the state level were able to support our response and just highlight for us all the different pieces that the state was able to support us with.
Well, Commissioner Ige, as you referenced, right, public health is a team sport, and it really requires the appropriate amount of coordination and partnership to make sure that we're doing all we can to make the residents in the city of Chicago, in Cook County, in the state of Illinois, as healthy as possible. We do that work, and the staffs of our local health departments, our healthcare facilities, our state public health department does that every day. But in the midst of a crisis, that coordination needs to be quick and swift, knowing that we need to tap into all of the resources, whether that's human, financial, or even just having the stuff that you need to make an impact. And so I think we were all on high alert when the first case was sort of confirmed in this shelter, knowing because of the unique situation that it could spread quickly, and that how could we collectively be decisive and impactful? We knew that the city and the leaders in the city were going to address many of the immediate problems. But how could we, as a state public health department, our state Department on Human Services, our own Illinois Emergency Management Agency, how could we move and sort of provide the requisite support that the state does when the local jurisdiction can't meet the needs. One area that we specifically saw right away was how could we help support those that were most vulnerable, individuals that could not get vaccines and have the ability to have housing that would protect not just those most vulnerable, especially pregnant women, children under 1, but their families, so that they would be housed together. And that was a big partnership between the Department of Human Services, the Illinois Department of Public Health. Second, we wanted to make sure that we could bring the state expertise, help partner to create the guidelines and protocols that were necessary to put this response forward. And then we were fortunate with the state, through the governor's leadership and with the help of the General Assembly, to have resources at our disposal for a crisis just like this, knowing that during COVID-19, through the Mpox, monkeypox response, that much of public health funding is often tied to a very specific event. But through the governor and the General Assembly's leadership, they did provide a flexible funding line in our budget to make sure that we were able to mobilize resources quickly, and we were able to do that for this measles response.
Thank you so much, Dr. Vohra. I am very glad that I ended up in Chicago and that Chicago is in the state of Illinois that is prepared to respond in the face of an emergency. I also recall very strongly going to the shelter and seeing, Dr. Cleanan there running back and forth with testing, supporting our teams. So even the human resources, the physical presence, Dr. Vohra, you and I were at, one of the locations where people were being housed and doing a tour together. You were there in person, I was there in person, just providing support on the ground. So we just want to say how appreciative we are, the city of Chicago, for your leadership and support and responsiveness in the midst of this crisis. I'm going to switch to Craig right now. Craig, from day one, Cook County Health has been supporting our new arrivals mission, even before there was an outbreak. To date, we have received over 43,000 new arrivals in the city of Chicago, and we quickly realized that the healthcare needs and the support there far overwhelmed what the city could do. And we reached out to Cook County Health, and you have been there supporting us from the very get-go. But during measles, that support just increased exponentially. Would you share with us, again, you can start from even before there was the outbreak, but then during the outbreak, how Cook County just rallied and came in and supported CDPH in this response?
Sure. Yeah, I think the new arrivals piece is important to highlight. Back in September of 22, when we started the new arrivals program, we set up a full-scale health assessment clinic at our Belmont Cragen location in I think literally 48 hours. And over the last 19 20 months, we've seen over 32,000 individuals, and those individuals have generated more than 100,000 visits across our system. So we've been really dedicated to the new arrivals program. At the same time, that effort has changed, right? There's been different demands. There's been times where patients that needed to be seen were kind of growing in backlog. And I think that's when we really started working closely with you, Dr. Ige, and the Chicago Department of Public Health. And I think really, for me, it really opened up the lines of communication. And I think we really understood both of our challenges, what flexibilities we had, where we could best put our resources. And I think we really kind of were at our stride in terms of our collaboration and partnership right as the measles outbreak happened. Mm-hmm. And I think that, for me, one of the biggest takeaways I have is that because we already had that established level of trust, right, I think we were really able to leverage those existing relationships, the workflows that we had developed, and just kind of maintain flexibility to point our efforts in a way that was going to be most effective to supporting the response to the measles outbreak.
Yeah, I cannot agree more. Dr. Vohra was saying this is a team sport, establishing those relationships under blue sky scenarios so that when it was the gray sky scenario, we know who to call and we knew that you were going to be there to support us. And I know that even part of the confidence that we had even going into the measles outbreak was that you were there already doing the healthcare screening. We already had data of who was coming into Cook County Health, and we could quickly decide who needed to be vaccinated, who didn't need to be vaccinated. And your teams were there on the ground doing symptom monitoring, etc. So we just needed this wraparound support. The state, on the one hand, helping us with the quarantine facilities, testing support, Cook County Health helping us with all the healthcare needs, before, during, and even after the response. And we are highlighting this partnership and relationship because people have asked me repeatedly, what did it take to be able to put in control an outbreak this big? And we wanted to highlight that this is what it took. It took collaboration with the city, with the county, with CDPH and our staff and our partners to make this happen. I also wanted to highlight briefly that, we also got support from the CDC with the EpiAid, just helping us with the data, our ability to respond quickly, and have some foresight into what to expect was due to support from CDC and some of our epidemiologists helping us to model, if we did this, this is what we could expect. If we did that, that is what we could expect. And being able to respond and start a mass vaccination within 24 hours. The data reveal that reduced the potential for that outbreak to have lasted for longer, reduced the duration by about 6 weeks. If we had waited one more week to start the vaccination, the outbreak will have lasted for longer than 6 weeks. And there was a 6 to 9-fold likelihood that we will have had cases in excess of 100. And so this partnership, we just wanted to highlight how important it was to the success. So in terms of measles itself and the infrastructure that we need for measles, we talked about having vaccines, having testing, having quarantine facilities, having staffing. Dr. Vohra, do you want to say a little more about how the state will continue to the surveillance, the response infrastructure, whether it's measles or something else? What are some of the resources available at the state that you may want to highlight for how we're preparing for future outbreaks, should there be any?
It's a great question, Commissioner. And what I think really important for the audience to know that a crucial part of public health forever, but especially now, post COVID-19, is how critical every day is around preparing for ultimate responses, both at the Chicago local level, at the state level. We have dedicated staff that are working every day to prepare for scenarios like this, thinking about strategies, the partners that we will need, because to this very conversation, when those things aren't built before the emergency, as Mr. Williams said, right, when those workflows, et cetera, haven't been worked out, that's when you're not going to be able to hit the crisis immediately. And Commissioner, as you said, right, time is of the essence. One of the things that the state did produce 1 year after the end of the COVID-19 national public health emergency and the statewide disaster declaration is a playbook that sort of talks about how the state is really thinking through how to really position us to deal with whatever the next emergency is. We knew, and even in a place where measles, and I think partly for all of us to understand, it was that measles at one point was declared eliminated in the United States. That happened in the year 2000, right? And so even the idea that we had to go through a response is sort of posing the challenges that we're facing. But it may not be an infectious disease, right?
Right.
We know that public health disasters public health emergencies can look very differently. So I think that's sort of that critical component. The resources, the planning, all of that continues to happen. And we need to get better at it. We need to think through the scenarios. And that's been a big place that the State Department of Public Health has invested people, resources, and even as we open this program, having those flexible funding streams to make an impact. But I think secondarily, as we think about measles in general, how important it is for us, state, local, our healthcare facilities, that to really sort of continue our messaging on how important it is for people to get vaccinated to prevent vaccine preventable illnesses. If we were in a situation, right, although this one was a unique one, that we had sort of those critical vaccination rates, the threshold, and often in a community for measles that's 95% around that, creates what we call herd immunity, right?
Right.
That it protects the entire community because enough people are vaccinated. One of the things that we saw during COVID was that our vaccination rates did dip down, and how important it is for individuals to know that because we were in a position that we had those high vaccination rates in 2000, we were able to declare that measles was eliminated in the United States. Right now in 2024, we're seeing pockets emerge. A lot of that is still based on individuals that are coming from outside of the United States, but we know it's creating pockets and clusters of individuals in Illinois and other states. And it is something that we want to be better at with our data. One of the other things that we released during the measles outbreak was a school vaccination dashboard. So you can go click on your county, your district, the school, and really see from our latest information if that community is at risk. But it's also continuing to say how important vaccinations are, that even when we're not in an outbreak, the best way we can prepare for a future measles outbreak or other vaccine preventable diseases is to go out there and get your vaccines to make sure that you and your loved ones are protected.
Thank you, Dr. Vohra. That is our core message in public health. For vaccine preventable diseases, the best way to do that is to be vaccinated. That's how we prevent these diseases. And we are also hopeful because we have all this preparation and training and data that helps us to know when there is a problem and to be able to respond in the event of an outbreak. I say to people, we're a big city, the city of Chicago, almost 3 million people. We get, millions of tourists, over 50 million tourists every year. And Cook County is also the second biggest county in the entire country. And so the infrastructure and the resources we need to keep our community safe is significant. Craig, do you want to say something about, the kind of infrastructure that you have had to stand up to help support the new arrival mission? We know you have that dedicated clinic, but, staff and resources that the county has dedicated and supported the city with over the last year or so.
Yeah, we've built up an entire program from the ground. We've spent a little over $30 million over the last 20 months in the new arrivals program. And, that's really been, we probably have about 25 nurses that are working with the program, about 8 MD providers, as well as some physician assistants that work with that program. And I think the other thing that we've done is that we've continued to really look at what were the pain points related to providing care to this set of patients, and how do we best reach them in a way that's going to be convenient for them. So like I said, we set up a clinic, and we're bringing everyone to Belmont Cragen, and probably about a year into the program, we realized that we weren't able to get everyone to Belmont Cragen. Not everyone was interested in receiving healthcare. Not everyone really understood how to navigate the U.S. healthcare system. So at that point, working closely with your team, we created out of the blue these mobile care coordination teams, and what they did is really go out to the shelters, meet with people living in shelter at the time, talk to them about the services that we offer, do some initial health screening, but also really talking out the services we can provide and then what they can get for ongoing care. And we're able to get a much better response in terms of people engaging in care. And the greatest thing that I think that I'm most proud of in the services we're offering is not only are we providing that health assessment, but we're getting the new arrivals into continuous care. So they're becoming part of our medical homes. They're able to see specialists. They're really getting the full, service of the U.S. health system, through Cook County Health. So it's great. I think the other thing that we've done most recently that's been particularly exciting is, partnering with Chicago DPH, because we've been actually going out. We have a team now going out to the landing zone. So as new arrivals are stepping off a bus, they go through a series of processes, and they get food and everything else. And the last thing they do is they actually see providers from Cook County Health. We're able to vaccinate them. So we're vaccinating them for measles right there the first day that they're in the city. And I think it's close to 70% of those patients we're able to get over to Belmont Cragen for that full health assessment, get any scheduled follow-up visits they need right after that. So that's something that we've rolled out in the last, I think, when we go live in April, and we've already seen about 3,100 people at the landing zone, with the team of dedicated providers there. So that's been really exciting for us. I think, the one thing that I think has worked really well is that we haven't been afraid to, and I think our partners have been willing to let us just try some stuff out. Right. And some of that stuff worked really well. And other things we said, oh, you know what, that didn't work as well as we thought. Like one thing we created was an app that people could use and sort of do a self-health screening. And what we found is that people weren't really engaging in that app to the extent that as easy as we made it, they just weren't interested. And so we sort of de-emphasized that. But there's other things that we tried, like the mobile care teams are going to the landing zone, that honestly, we thought they would work out well. But were they fully baked or are they operating today like how we envision them? Probably not. So that to me is the biggest takeaway, is any of these kind of crisis events, you just have to be willing to just try things and really look and say, is that having an effect? If it is, build on that. If it isn't, be willing to kind of pull back on it. So, and I'd say you guys have been great in just kind of working with us on those small tests of change.
Yeah, I just want to say thank you for your flexibility and innovation. We've tried different ways to get vaccines into arms, and, at the clinic, through mobile services, and now at the landing zone. As Samir was highlighting, vaccination is just so important in disease protection, prevention. So, we've used all the tools in our toolbox to do that, bringing vaccines on site, bringing vaccines to the landing zone. So we have really relied on that partnership and support from Cook County Health. And as we look forward, for us in CDPH, we continue to prioritize populations that have, more health needs, including our new arrivals, and making sure that we are keeping abreast of disease notification. And once we're getting a notification, we're responding as quickly with case investigation, investigating every case, making sure data is available, working with all of our partners to ensure that there are no gaps in our services and just providing this wraparound support. Those were some of the ways that we were able to achieve this quick control of such a large outbreak. And we have been using similar models in just other different ways. So we wanted to highlight for other big cities, other jurisdictions across the country, how collaboration and partnership is so vital for the successes we have in public health. Even in big cities like us with big departments like CDPH, we still rely heavily on our partners at the county, our partners at the state, and many of our community-based, faith-based organizations that come and help us in this work. Public health is a team sport. And I highlight all of that so that in future public health priorities, we hope that we can continue to collaborate with you to figure out what healthcare needs are, where there are assets and resources, how we can collaborate together to protect our residents. We know if it's in Chicago, it will get to Cook County. If it's in Cook County, it will get to Chicago. And we know that we can always call on the state to support where needed. I want to close on some of the work that we will continue to do together, especially for the new arrivals. You touched on the landing zone and how we are ensuring now that everybody coming through the landing zone is getting vaccinated and getting healthcare support. Dr. Vohra, I know that at the state, there are also explorations for the Medicaid support that is necessary to support those who are newly arriving. And so I want to highlight that our work is not done. We will continue to work together to close the gaps in healthcare needs and support for our new arrivals, but also for all the residents who are here. And we're working together on many of those other issues as well. So I don't know if you have any last words, Dr. Vohra from the state, or Craig from your end, for our viewers to just, this is the lesson: partnership is key. Public health is a team sport, but any other lessons that you want to highlight for successful public health and healthcare partnerships?
Well, I'll close by just saying that every single day it's critical for people to understand that public health behind the scenes is working to prevent outbreaks, right? Prevent individuals from being sick. And part of it is a continuum from the things that we do that with your air quality or environmental health, making sure that your restaurants and your food is safe, all the way to the stuff that happens inside Cook County Health and the most advanced technology to make sure that we're preventing diseases to get worse. And that's a continuum, and those partnerships are critical every day. And it's important for us to kind of uplift those moments because we know that health is crucial to making sure that we're happy and healthy. And the more that we do, as the term of art, in every normal day and those blue sky days, as the commissioner mentioned, will really be in a great spot to make sure that we have as few crises as possible. And when those crises happen, because ultimately they will, that we can have the effective response that we did with measles. And that's a testament to the important work and collaboration that happens every day.
Thank you.
Yeah, I guess I would say too, I think, working in hospitals for a long time, and I think the intricacies of a 24/7 operation like that, really require us to prepare for the worst at all times. We hope for the best, but we are constantly looking at, what is the worst scenario that could happen in the new arrivals mission, in measles outbreak, and the Democratic National Convention and being around the corner. And I think that's one thing that, the public should feel good about, is that we are constantly contingency planning, really thinking about how could our system get stressed and how do we prevent that? And even though it seems like we've been through a lot of the worst over the last few years, I think that the way everyone has responded really does provide hope for, how prepared we are and how we can kind of keep things moving. So I think that's definitely a key message.
Yes, and I say thank you for the words of encouragement and reassuring people that we remain committed to our mission of keeping the residents safe and healthy, and that we have demonstrated that we are always on the alert, always ready to do that work, regardless of whatever the threat is. We're ready. Thank you very much for your partnership, and we look forward to more successes in the future.
Thank you so much.
Thank you.
And that's our show. Thanks for joining us today. Don't forget to rate and subscribe wherever you find podcasts. I'm Dr. Vohra, and we'll see you next time.